coming up towards 7:15 in Trinidad and Tobago. Well, let's talk about something now that I know many of you might be interested. Cosmetic enhancement, all those things, Botox, fillers, all sorts of different things that you pump into your face and other parts of the anatomy to I don't know, enhance it, I don't know, but we'll find out. Because all over the world, that is a big trend in many respects. But the benefits go past just the simple issues of vanity. And that's people like myself, who tend to have this attitude that is all about just vain people, just trying to look young. They're 95 years old, but they're trying to look 25. Well, here's Dr. Rachael Eckel, who's a cosmetic doctor, who's been on this program before. You'll recall, which she had a mentor with her a few months ago, talking about these different procedures and how they can actually benefit you and not just be some kind of glorified plastic in many respects. Dr. Eckel, good to have you with us once again.
Thank you so much for having me,
Thanks
Fazeer.
very much for joining us. By the way, if you want more information on all of the information that you're going to be hearing about, you can find them on Facebook at Dr. Rachael Eckel. You can go to www.theskinhealthinstitute.com, or you can call 622-SKIN, and you can check your phone, what the SKIN would stand for. So what are we talking about particularly today?
So we're talking about facial injectables, things like Botox and dermal fillers. And the most common question that I hear in clinical practice is, what is the difference between Botox and dermal fillers? Because they're two very separate things. So I want you to think of Botox as, that's just a brand name. So that's one company that makes it, but it's very well known. It's called Botox. Botox is basically a neurotoxin. It's a solution that we inject into muscles in order to get different effects. For example, we can use it to get rid of lines and wrinkles, so the frown line. So when you get the number 11s and you look angry, we can use it to soften that. But we can also use it for a lot of different medical reasons. For example, people who have hyperhidrosis of the palms. So they're very embarrassed when they come to shake your hand and it's wet.
Yeah.
So you can use it to reduce the sweat production. You can also use it to treat skin disorders like rosacea. You can use it with acne. We can use it for people who have TMJ disorder that clench and bite overnight and they have grinding of their teeth. We can use it to soften those muscles. We can also use it for migraines. People who have a lot of tension, headaches, it works beautiful in that. So it's not just cosmetic reasons. There's a lot of other medical reasons that we can use Botox for. Dermal fillers, on the other hand, are something completely different. They are a sugar molecule called hyaluronic acid. For example, that's the most common one. And the sugar molecule attracts water to it. So it's like a sponge that attracts 1,000 times its weight in water. And when we put it into the face, we can do many different incredible things with it. So when we first got dermal fillers about 15, 20 years ago, we didn't really understand how to use them. And as a result, we had really unnatural results because we didn't quite understand their value or their role. And like with any medication, when we first get it, how we use it 10, 15, 20, 30 years later is going to be vastly different as we understand the efficacy and the safety profile. What we're using dermal fillers now goes way beyond just plumping the face and adding lost volume. We can use dermal fillers, for example, to help patients who have an asymmetric face, like if they've had a stroke or if they have Bell's palsy, where one side is falling down, to correct the musculature and perform something called myomodulation on the face to restore the muscles and the balance in the face.
And I'm sure, as you mentioned, because the technology is developing all the time, different procedures and so on, I'm sure you would have many cases of procedures gone terribly wrong. How do you deal with situations like that?
So the most common thing that I see that has gone wrong in patients is poorly injected dermal fillers. So remember that dermal fillers is something that it's a bit of an unregulated industry, meaning that you can, be an OBGYN and do a weekend course and learn dermal fillers and then come home and on the side you start, injecting fillers. And this is not just in Trinidad, this is all over the world. So we're having a lot of issues with physicians who are not in this specialty, who are performing these procedures, and they don't have the eye, they don't have the technique, they don't have the skill to do it correctly. So they also don't have the skill to diagnose correctly. So what you tend to see happening is a patient will come into them, and a patient who's 40 years of age, who has lots of age-related changes in the lower face, will come in and say, I want to do my lips. And the injector just listens to the patient and does the patient's lips. But 9 out of 10 cases in a 40-year-old or 45-year-old, you didn't need your lips injected. You needed to change and re-augment the lower third of the face to support the lips, right? Because it's basically lost volume in the chin region. So you didn't need your lips. It was a different diagnosis. So it's not just about learning how to inject. You have to be able to diagnose. You have to be able to explain to the patient. You have to be able to discuss finances. Many different things go into a good injector. So what I see a lot is patients coming in with the wrong injections. Big lips, huge cheeks, something that looks very unnatural, and they don't like their results. And so the first thing that I do is I dissolve it. I actually get rid of it, which is good with fillers, that we can get rid of this type of molecule. So I break it down to build it back up again. So poorly performed injections is the most common, I guess, unwanted side effect that I see in my clinical practice. The other thing that I do see a lot of is patients who have had side effects in Trinidad of injectors who have come from outside of Trinidad, for example, from Venezuela. On Friday, I had a patient who had basically a permanent filler, this is I think about 10 years ago, injected into her cough. And the permanent filler was in the cough, and has now 10 years later, she has these huge permanent side effects in her leg. She basically looked like she has a deep vein thrombosis in her leg, and her leg is permanently swollen and mottled in appearance, and she doesn't like to wear, nice shoes anymore. She's always covering her leg. And that's something that's permanent. That's a permanent filler that can't be removed. So you have to be so careful who is injecting you, what is their level of expertise, is this something that they're trained in specifically? And remember, it's not just medicine, it's also an art. So it's not the paintbrush or the paint that makes a masterpiece. It's the actual painter, and it's the same thing with an injector.
Before we run out of time, I know you want to talk about the issue of correcting dark circles and so on, which could be very relevant to us here in Trinidad and Tobago. But just on the point, and we had this discussion, I know, before on the previous occasion, just the idea of injecting anything into your face or your body or whatever, it sounds unnatural. And isn't it, by its very definition, something that could be potentially dangerous?
So we know that we are losing hyaluronic acid in our skin and in our tissue. And every year we lose about a teaspoon of hyaluronic acid in our face. Now, what we're re-injecting into the face is hyaluronic acid. It's a natural molecule. It's everywhere. You have it in your skin, in your tissue. It's everywhere in your body. So we're just re-injecting a very naturally occurring substance into the face anyway. And the beauty behind that type of filler is that it's not permanent. And if there's ever a side effect, you can get rid of it and you can dissolve it. Now, with regards to dark circles, that's a great question, because that's actually the most common injection that I perform in my clinic. And it's really common in patients of Indian ancestry. So in their genes, they tend to have a hollowing underneath the eyes and a sink. And no amount of concealer or makeup can hide the sink, because it's a dip, and therefore the light, when it hits it, is going to shadow. So what we do is we lift from below with the dermal fillers. So strategically placed molecule underneath the skin will lift it up, give it a little bit of support, so that when the light hits it, it doesn't shadow anymore, and it has a really natural, lovely appearance. I actually have it done myself.
Okay, and as far as, the whole question as to whether or not, because so much is especially related to the face, and not just females but males as well, that you lose your sense of identity, you lose your character when you remove all the lines, when you remove all of the facial features that you might see as imperfections, but really are a reflection of a life well lived in some ways.
I think that I would argue the opposite. I would argue that the aging process in many patients causes them to lose their identity, that they become very insecure about how they look. They have people telling them, why do you look sad? Because the mouth turns down with age. Why do you look tired? Because we lose volume around the eyes. Why do you look so angry? Because of the number 11 lines. So I think that there's a great quote, which is that as we age, we become caricatures of our younger self. And the aging process for many patients, they don't like what they see when they look in the mirror, and it has a negative effect on their confidence. And so when you restore that volume to the face, or correct the issues, the age, in a very natural, subtle way, they walk out and they're so happy and they're so confident and they feel beautiful and they feel young and energetic. But remember, it's not about making a patient necessarily look younger. It's about taking that 50 or that 70-year-old and respecting their age, but making them look like the very best version of themselves at 50. So making them look less angry, less tired, less sad, changing those negative first emotions that occur as part of the aging process because of the way anatomically that the face ages.
But and finally, and I'll ask you to remind everybody about the contact information if they want to get more information on the services that are offered. Do you look more artificial, more plastic?
Well, I think that it's an evolution that has occurred in this field, and I think that that is an outdated way to look at it. I think that now we realize that less is more, and we understand now how to treat the face correctly. For example, in the old days, people didn't like this line. We said, okay, we're going to go and fill this line. But that makes you look puffy in the middle of the face, and that's not attractive, and you look done. So now we know that this line is a symptom of volume loss occurring in the outer face. So now we get it. Now we understand that to correct this line, you have to go upstream to lift things. And so because of these new advances in the techniques, we now are able to make patients look very natural, very subtle, like they have absolutely no work done.
Okay, well, sounds interesting. And for those who would like to get more information on the services that I offer, just remind us how they can contact you once again.
So my clinic is called the Skin Health Institute, and our number is 622-SKIN. And you can find us online on social media at the handle at Dr. Rachael Eckel.
Dr. Eckel, thanks
Thank
very
you
much
so
for
much.
joining us once again. And it's an interesting dialogue when we talk about these developments as far as looking a lot better and feeling a lot better and the different perspectives on it. And I'm sure the fact that many people are seeking the services of Dr. Eckel and others involved in the business will suggest that it's the way of the world. It's what's happening these days. People want to feel better about themselves. Well, maybe we should live in a better country as well to feel better about yourself. 7:27 and 7:25, 27 in Trinidad. Maybe I need to fix my eyes to see the clock a little better. 7:27. We'll be back right after this.